In our talk about depression, we will start with an overview. So, depression is a mood disorder, and the term depression is widely used to describe low mood. And low mood means feeling of sadness, feeling of emptiness, and feeling of irritability. And for context, the word mood means the state of mind and the predominant emotion and feeling expressed by a person. Examples would be angry mood, irritable mood, sad mood, and happy mood. And in depression, the predominant feeling would be sadness, emptiness, and irritability, as we mentioned. Now, in addition that depression affects the person's mood, it also affects their thoughts, behavior, and sense of well-being. And the medical term for depression is depressive disorder. Now let's talk about the depressive disorder types. So the depressive disorder is classified into many types according to the International Classification of Diseases. Now in this video, we will mainly use the International Classification of Diseases, the ICD, types of depression, and criteria for diagnosis, both from the ICD. So we have the single episode depressive disorder, which is called unipolar depression, and it is called unipolar because of the presence of the bipolar disorder. So to better understand this, we have to understand this graph. So this is here the normal mood. This is pretty normal right here, and this is our mood during the happy times, and this is our mood during the sad times. And it is like that. Between those two lines is our normal mood. Now, if our mood exceeded the lower line like that, we have depression or depressive episode. But if our mood exceeded the upper line, we would have mania. And whenever a person had a manic episode, then they would have a bipolar disorder. Now, depression is characterized by sadness, as we mentioned, while mania is characterized by happiness. So now we have a single episode depressive disorder, we have a recurrent depressive disorder, we have persistent depressive disorder, and we also have a mixed depressive and anxiety disorder, and we have other specified depressive disorders and unspecified depressive disorders. And we will explain each of these types later in this video. So all these disorders share the presence of a sad, empty, or irritable mood, and they are also accompanied by changes in person's capacity to function, and what is different between them is the duration, the timing, and etiology. Now let's talk about the diagnosis of a depressive disorder. So, in order to diagnose a depressive disorder episode, there is a number of symptoms, which is the International Classification of Diseases criteria, that must be present for at least 2 weeks. So the ICD criteria include criteria A and criteria B. So the criteria A include persistent low mood, which is the sad, empty, and irritable mood that we talked about, and also the presence of anhedonia. Anhedonia is loss of interest or pleasure. So the person with depression would feel less interest and pleasure compared to people who doesn't have depression. And we also have in criteria A, anergia. Anergia means fatigue or low energy. So a person with depression would feel low energy. Criteria B include reduced concentration and attention, and it also include reduced self-esteem and self-confidence, and feeling of guilt and worthlessness and hopelessness about the future, and also suicidal thoughts and disturbed sleep in form of insomnia, which is less sleep than normal, and hypersomnia, which is more sleep than normal. And there is also appetite and weight changes. Either there is decrease in the appetite and decrease in the weight, or there is increase in appetite and increase in weight. And regarding the interpretation of this criteria, so interpretation is either into mild, moderate, or severe depressive disorder. So mild depressive disorder is when there is 2 or more from the criteria A and 2 or more from criteria B. Moderate is when there is 2 or more from criteria A and 3 or more from criteria B. And severe is when there is all of the criteria A and 4 or more from the criteria B. And remember, those should be present for more than 2 weeks for the diagnosis of the depressive episode. Now, in depressive disorder episode, we also have other symptoms. Other symptoms include psychomotor retardation, which is slowed movements and thinking and low voice. And we also have psychomotor agitation, which is the opposite of the psychomotor retardation, which means excessive movements and feeling of inattention. And person with depression may also suffer from loss of libido, constipation, and amenorrhea. So now the single episode depressive disorder was explained that we must have a certain criteria met and it should be present for more than 2 weeks. Now let's explain the recurrent depressive disorder. So if more than 2 episodes lasting more than 2 weeks in a person, then it would be called recurrent depressive disorder. So in single episode depressive disorder, we have a single episode. In recurrent, we have more than 2 episodes for it to be diagnosed as recurrent depressive disorder. We also have the persistent depressive disorder. This one also called dysthymic disorder, and it is a long-standing mild depressive symptoms lasting 2 years or more. And dysthymia often occur with other psychiatric and physical illnesses. Now, in the ICD classification, we also have mixed anxiety and depressive disorder. So in this disorder, we have symptoms of both disorders are present for more than 2 weeks, but neither meet the criteria for diagnosis of any of them. And this disorder is very common. Now, in the other specified depressive disorders, we have the psychotic depression. Psychotic depression is the most severe type of depression. The person's worries and misdemeanors that are present in the depressed patient, they would become beliefs. And because they are false beliefs, they are called delusions, because delusions are false beliefs. And the person may also believe that part of them is dead, and they also experience derogatory auditory hallucinations. So now they would have delusions, which are their worries and misdemeanors, which become as beliefs, termed as delusions, and they also have auditory hallucinations. In addition to their depression, and suicide risk is high in this disorder. Now also, in the other specified depressive disorders, we have the seasonal affective disorder. This is a recurrent depression that is related to a certain season that happen in a person. And typically during the late fall and early winter, this is the most common time for the seasonal affective disorder, and the patient goes back to normal the rest of the year. Now, it is important to pay attention to this note. So, depressive disorders should not be diagnosed in individuals who had a manic, hypomanic, or mixed episode before, because in this case, the diagnosis is bipolar disorder. So once a person had a single manic episode in their life, then when they have depression, we would diagnose their depression as bipolar disorder. Now let's talk about the epidemiology. So globally, 5% of adults suffer from depression according to the World Health Organization, and females are 2 times more affected than males, and the mean age of onset is late 20s. Now, in depression, there is no specific cause that is identified, but there is risk factors. Risk factors include the neurotransmitter imbalance, so alterations in serotonin, norepinephrine, and dopamine, and that is what we try to correct with the treatment of antidepressant drugs. And there is also the neuroendocrine factors, which include the hypothalamus, pituitary, adrenal axis dysfunction due to chronic stress, and also neuroanatomical changes, structural changes of the brain, especially changes in hippocampus, amygdala, and prefrontal cortex due to stress, inflammation, and neurotrophic factors, and also genetic factors. So there is 4 genes identified to be related to depression, and also neuroplasticity, which is changes in brain ability to adapt. And risk factors also include psychological trauma and cognitive factors. So, example, the negative thoughts pattern and distorted cognitive processes. Moving on to talk about the lines of treatment of depressive disorder. So we have the first line as being the psychotherapy in form of the cognitive behavioral therapy and the other methods used. The second line in depression treatment is the antidepressant drugs, which we focus on in the central nervous system pharmacology masterclass. And we also have the other lines, which include the bright light therapy, the electroconvulsive therapy, the transcranial magnetic stimulation, the vagus nerve stimulation, and the deep brain stimulation. Finally, let's talk about the antidepressant drugs classification. So they are classified into many classes that we will explain in separate videos for each. So we have the monoamine oxidase inhibitors, we have the tricyclic antidepressants, we have the selective serotonin reuptake inhibitors, and the serotonin norepinephrine reuptake inhibitors, and the atypical antidepressants. And with that, we reach the end of this video. Thank you guys for watching. Please support this video by giving it a like and commenting your ideas and questions. And this video is a part of a bigger class. It's called the Central Nervous System Pharmacology Masterclass that will appear on your monitor right now if you want to check it out.